All right, so you're getting ready for this huge moment, right? Having a baby.
Yeah.
And probably thinking a lot about, well, everything. So today we're doing a deep dive on C-sections. We're going through this booklet called What Every Pregnant Woman Needs to Know About Cesarean Birth. It's put out by the National Partnership for Women and Families, and it's got some, well, I wouldn't say scary, but definitely eye-opening stuff. Like, did you know 1 in 3 women in the U.S. end up having C-sections? 1 in 3? That's wild.
It's definitely something to be informed about, especially because, and this is important, vaginal birth is generally considered safer, both for mom and baby.
Yeah, which makes sense when you think about it, right?
Yeah.
I mean, it's how we were designed.
Exactly. However, and this is crucial to remember, there are absolutely times when a C-section is the absolute best medical choice.
Oh, absolutely. Like those emergency situations you hear about sometimes.
Precisely. Like if the baby is in what's called a transverse lie, meaning instead of being head down, it's kind of sideways in the uterus, that can prevent the baby from, coming out safely. Or if the placenta is covering the cervix, that's called placenta previa, same thing. In those instances, a C-section, it's essential.
Okay. Yeah, that makes total sense.
Huh.
But still, 1 in 3 women having C-sections. That's a lot. And one thing that really struck me in this booklet is how your birth experience now can actually impact future pregnancies, like the choices you have and even potential risks. I bet that's not something a lot of people think about.
It's true. And it can be a big deal. For one thing, finding hospitals and providers who fully support VBACs, that's vaginal birth after cesarean,
Yep.
can be surprisingly difficult.
Really? Wow.
So a C-section now might actually limit your options later, potentially even leading to more C-sections down the line, even if you'd be a good candidate for a VBAC.
Oh, wow. So you might feel stuck with whatever's available where you live.
Unfortunately, yes. And then there's the safety aspect, too. Any future pregnancies are considered higher risk after a C-section.
Higher risk because of the surgery itself.
Partly, there's the scar, for one. There's a risk, though small, of it tearing during labor, or it could cause issues with how the placenta attaches. Plus, the chance of stillbirth does go up, which is, well,
Yeah.
it's something we never want to gloss over.
No, for sure. So even if you're thinking, well, I only want one child, this is still really important information.
Absolutely. Unplanned pregnancies happen more often than you'd think. And it's about being informed about your health history, even if you're not currently planning for more kids.
Right. Knowledge is power. So we've talked about how C-sections are sometimes essential, but vaginal birth is generally considered safer. Now, this booklet also goes into how a lot of C-sections might actually be preventable, which is a really interesting angle, right? Like, what can we do?
It really is. And it starts with understanding, all the amazing benefits of a vaginal birth.
Okay, sell it to us.
Okay, so for you, the mother, it usually means a faster recovery, usually less pain, and more time to bond with your little one right away.
Right, because we can't sugarcoat it. Labor is tough.
It's definitely work.
But I love how they talk about it in the booklet. Like, your body is literally doing this intense workout to get ready for what comes next.
Exactly.
So it's not to minimize anyone's experience,
Yeah.
but it's a powerful way to think about it.
It really is. And that kind of natural process is generally easier on your body long-term compared to a C-section, which is, well...
Major abdominal surgery.
Exactly.
Yeah, it's easy to forget that when you're just focused on, getting that baby here safely.
Absolutely. And we can't forget about the benefits for the baby either.
Oh, right. Tell us more.
So, you know how we're learning more and more about the importance of a healthy microbiome?
Uh-huh.
Well, as the baby makes its way through the birth canal, it's exposed to good bacteria.
Yeah.
And that actually helps them build a healthy microbiome right from the start.
Wow, I had no idea it started that early.
Yeah.
That's amazing.
And all those hormones that get released during labor, they aren't just for you. They're thought to have big benefits for your baby, too, like helping their lungs prepare for that very first breath.
Wow, so it's really like this incredible symphony, this symphony of biological processes that, like, benefits both of you.
It really is.
That's amazing.
Yeah.
And I definitely don't want to downplay the fact that, complications can happen. Those are real concerns, and every birth is different. But it sounds like, generally speaking, the benefits of a vaginal birth are pretty awesome.
I think that's a fair assessment.
Yeah.
Now, of course, we do need to address that vaginal birth can have some downsides, too.
Right, of course.
Tearing is pretty common, but it's usually minor and heals well. There's also, risk of muscle weakness or issues with the pelvic floor, which can lead to,
Oh, yeah, like,
sometimes leaking a little when you sneeze or laugh later on.
been there.
Yeah,
It's definitely something that no one tells you about beforehand.
it's true. And while rare, there's always a chance of injury to the baby during a difficult delivery. But it's crucial to remember that statistically, those risks are generally lower than those associated with a C-section.
Okay, that's good to know.
Uh,
It's usually not as scary as it sounds. And I'm guessing those risks during vaginal birth, some of them come from interventions, right? Like if they
Yeah.
need to use forceps or
Yeah.
a vacuum extract,
Absolutely.
which honestly, we could do a whole other deep dive on.
A topic for another time.
So we've talked about the benefits and risks, and it really seems like in a lot of cases, those benefits of a vaginal birth, well, they kind of win out, right?
They often do.
Okay, so how do we actually prevent those unnecessary C-sections? Because
Yes.
that's what I love about this booklet. It really seems to suggest there are things we can do.
There are definitely things.
Okay, like what? How do we stack the deck in favor of that safe vaginal birth?
Well, for one, choosing the right care provider for you is huge. We're talking about someone with a low C-section rate.
Okay, that makes sense. But honest question, how do you even figure that out? Do you just like straight up ask, hey doc, how many C-sections have you done?
You absolutely can ask that, and should.
Right.
Don't be afraid to be direct about it. Ask about their approach to birth, their C-section rates for different situations, like first-time moms versus those who've had babies before.
Okay.
And here's a really interesting fact statistically, midwives tend to have much lower C-section rates compared to physicians,
Really?
sometimes by as much as 50%.
Whoa, 50%,
Now,
seriously.
see, it's significant.
Wow. I had no idea.
And beyond your provider, staying active during your pregnancy makes a difference.
Okay, so this is where my love for prenatal yoga comes in handy.
Exactly. It's not about forcing yourself to become a marathon runner overnight, but think of it like training for a marathon, except the prize at the end is, a million times better than a medal.
Love that. Okay, so what else can we do?
Continuous labor support is a game changer. Having someone like a doula by your side has been shown to significantly reduce the need for C-sections.
Okay, for those of us who don't know all the lingo yet, remind us, what exactly is a doula?
A doula is basically your birth champion. They're a trained professional there to support you through the entire process. Pregnancy, labor, those early days after the baby arrives. They provide emotional and physical support, they're a source of information, and they advocate for your wishes.
It's like having that super experienced friend who's been there,
Yeah.
done that, right there with you. Okay, so being informed, having the right support, that's key.
Absolutely. And here's a tip that might surprise you. The booklet talks about how delaying your arrival at the hospital until labor is really going can make a difference.
Wait, really? So like resisting that urge to rush to the hospital the second you feel a contraction?
Exactly. Often being in that hospital environment, especially for first-time moms, it can create a sense of,
Being observed.
yes, and even managed, which can sometimes make you more anxious and potentially even slow down labor.
Interesting. So just hang out at home a bit longer, bake some cookies, take a walk, let things unfold.
Exactly.
Okay, this is making me rethink my birth plan.
Okay.
All right, so say we're at the hospital. What else can we do?
Stay mobile, if you can, that is.
Okay.
Walking, changing positions, even dancing it can help labor progress more efficiently.
I love the image of a dance party in the delivery room.
Okay.
Okay, so to recap all this empowering info,
Yeah.
choose a care provider you trust, stay active, maybe look into a doula, wait for active labor before heading to the hospital, and once you're there, keep moving. This is amazing. This booklet is blowing my mind with all these tips.
Right. And speaking of empowering yourself, they also dive into a topic that can be, well, a little intimidating, questioning the need for a C-section if it comes to that.
Yeah, I can see how that would be tough. I mean, these are the medical professionals. They've got the degrees and everything.
Right.
It can feel, I don't know, almost wrong to question them.
Yeah, but you're right. It is your body, your baby, your birth.
Exactly.
And you have every right to understand what's happening.
Mm.
This booklet really emphasizes that, advocating for yourself, asking questions, making sure you're comfortable with the decisions.
I love that. So let's talk about some situations where, a C-section might be suggested, but maybe vaginal birth could still be an option.
Okay, so one that comes up a lot is, the whole big baby thing.
Oh, yeah. that baby's going to be huge.
Right, like it's some kind of prize watermelon. But
Zzz.
here's the thing. Unless there are other risk factors like gestational diabetes, or if the baby isn't growing at a healthy rate, most women can and do deliver larger babies vaginally without a problem.
Oh, interesting. So it's not an automatic C-section just because they're estimating a bigger size.
Not at all. Another common one is when labor is, moving slowly.
Yeah,
It's easy to feel that pressure to speed things up, but sometimes you just need to trust the process.
it's true. We're so used to instant gratification these days.
Right. We're not always so good at waiting.
Not always.
But the booklet really emphasizes that as long as both you and the baby are doing well, and labor is steadily progressing, even if it's slow and steady, that's often the best approach.
Patience is a virtue.
Especially in labor. So true. Okay, what about if labor just seems to, completely stop?
Yeah, that's often called stalled labor, and it can definitely be concerning.
Yeah.
But even then, there are often things you can try that are non-invasive, like changing positions, walking around, maybe getting some extra fluids. It doesn't always have to mean going straight to a C-section.
This is so empowering to realize you have options.
Exactly.
So it sounds like if your doctor's suggesting a C-section, you really have to, speak up.
Yeah, don't be afraid to ask those questions. Understand why they're recommending it, what the alternatives are, and advocate for what feels right to you.
Absolutely, because it is a big decision.
It is. And actually, the booklet has this super helpful list of questions to ask if a C-section is being considered.
Oh, wow.
I like to think of it as, a cheat sheet for this major life event.
That's so smart.
It can help you get all the info, weigh the benefits and risks, and just have a really open conversation with your care team. I love that. Okay, so we've talked about situations where a vaginal birth might still be possible, even if a C-section is brought up. But we also need to acknowledge that sometimes it is the best option. So let's talk about how to make a C-section a positive experience if it does become necessary.
That's so important because knowledge and preparation, even in those situations, can make all the difference.
It's not like you just give up all control, right?
Absolutely not. You've still got choices. For example, the booklet talks about timing.
Okay.
If at all possible, waiting until at least 39 weeks before a scheduled C-section is ideal.
Okay, so unless there's a medical reason to do it sooner.
Exactly. Those last few weeks of pregnancy, they make a big difference for the baby's development.
That makes sense. What about doing the actual C-section? Are there things you can ask for there?
Oh, for sure. One thing that's often overlooked is requesting antibiotics during the procedure.
Oh,
It might seem like a small thing, but it can really lower the risk of infection.
that makes total sense. I mean, it's standard for so many other surgeries.
Exactly. And don't be afraid to advocate for your birth preferences in general. This could mean anything from asking for photos or videos, to capture the moment.
Oh my God. Yeah.
It can be so powerful to look back on those.
Absolutely. Those first moments are such a blur anyway.
Exactly. And another thing, don't underestimate the importance of immediate skin-to-skin contact after the C-section.
Oh, right. We usually think of that with vaginal births, but
It's just as crucial for C-sections.
okay.
It helps regulate the baby's temperature, heart rate, even their blood sugar. Plus, it's amazing for bonding, and it can even help with breastfeeding.
So much packed into that one little act.
Right.
Okay, what about after the C-section, in those first few days and weeks?
This is where having a good support system is key. Remember, this is major surgery. Don't be afraid to ask for help.
Yeah.
Having your partner, family, friends around to lend a hand, whether it's with meals, errands, or even just holding the baby so you can rest, it's crucial.
So true. We often put so much pressure on ourselves to bounce back right away, but
It's just not realistic.
no, it's not.
Give yourself grace and ask for that support.
Absolutely. Well, this has been so informative. Any final words of wisdom for our listener as they navigate all of this?
Going through this booklet, the thing that really stuck with me is how much it emphasizes that birth is so personal. And it's not just a physical event, it's emotional too. It can have a lasting impact way beyond just, getting the baby here safely. It's about setting the stage for that transition into parenthood.
So well said.
So, to our listener, my final thought is this. Your experience matters. Advocate for your needs. Talk to your care provider, and never hesitate to reach out for support.
I love that. Knowledge really is power. And feeling empowered to make informed decisions, that's what the deep dive is all about.
Absolutely.
So listener, we're sending you good vibes as you go on this journey. And remember, whether you have a vaginal birth or a C-section, the most important thing is that you and your baby are healthy and safe. We'll be back soon with another deep dive into a topic that matters to you. Until then, stay curious.